Welcome back, everyone. Ready to dive into another deep dive with us. Today, we're tackling something a little bit different and maybe, honestly, a little bit scary. We're going to be looking at the potential dangers lurking in our everyday medications.
Ooh, yeah, that sounds a little scary, but it's really important, I think.
Absolutely. It's all about being informed.
Right.
And making sure we're taking care of ourselves the best way we can. We did some research on this, and the numbers are pretty startling when it comes to neurological diseases.
Yeah, for sure, like dementia, Parkinson's, and Alzheimer's.
Exactly. The World Health Organization actually predicts dementia cases will triple by 2050.
Wow.
Yeah, it's going to be affecting a staggering 150 million people.
That's a global health crisis.
Yeah, for sure. And what's even more concerning, these conditions are no longer considered just diseases of old age.
Right, yeah, we're seeing younger and younger people being diagnosed.
Makes you wonder, right?
Yeah.
What's going on? What's changing? So let's dig into some of this research and look at some of the medications many of us take every day.
Yeah, like one category I think is worth looking into is benzodiazepines. Now, these are commonly prescribed for things like anxiety and insomnia.
Yeah, I've heard of those.
Yeah.
They're supposed to calm you down and help you sleep, right?
Yeah, exactly. The idea is they work by slowing down brain activity,
Okay.
which is helpful in those situations, but that's where things start to get a little bit worrisome, especially when we look at long-term use. There's actually a growing body of evidence linking benzodiazepines to an increased risk of Alzheimer's disease.
Oh, wow. Okay. What kind of evidence are we talking about?
Well, there was a study published in the British Medical Journal.
Oh, okay. So pretty reputable.
Yeah, it's a highly respected source.
Like,
And they found that using benzodiazepines for over 6 months, so 180 days, was associated with a doubling of the risk of developing Alzheimer's.
double the risk. That's a lot. Are doctors even aware of this?
That's the question, and it gets worse. Another study, which was a meta-analysis,
So they look at multiple studies.
right, found that for every 20 additional doses of benzodiazepines taken per year, the risk of dementia increased by almost 50%.
Wow. So these medications that are supposed to help us manage anxiety and sleep could actually be putting us at risk long term.
It's a real possibility,
It's definitely something to think about.
for sure, and one that we need to be talking about more openly.
Absolutely. So benzodiazepines, we should be cautious. What other medications should we be aware of?
Well, another class that warrants our attention is anticholinergics.
Okay.
And these are used for like a wide range of conditions, from allergies and digestive issues to Parkinson's disease symptoms. Common examples you might recognize are like diphenhydramine. You find that in over-the-counter sleep aids,
Okay.
or scopolamine, which is often used for motion sickness.
So you might just be taking these without even realizing it?
Right. The problem here is they interfere with acetylcholine,
Okay.
which is a neurotransmitter that's super important for memory and learning.
Ah,
It basically disrupts the chemicals our brains need to function properly.
that doesn't sound good.
Yeah, so studies have shown that prolonged use of these, especially in older adults, can lead to cognitive difficulties.
Okay.
One study published in JAMA Internal Medicine actually found a link between these medications and cognitive problems in people over 65.
Okay.
And another study in the British Journal of Clinical Pharmacology found that after just 90 days of use, there was a sharp decline in cognitive function.
So it's not even just long term.
Yeah, even short-term use could have a negative effect.
Wow. Okay. It makes you wonder why this isn't talked about more, these risks.
Right. It's a good question.
All right, so we've got benzodiazepines and anticholinergics. What else?
Let's talk about statins.
Oh, yeah.
So these are cholesterol-lowering drugs widely prescribed.
Yeah, to reduce the risk of heart disease.
Right, and they can be really beneficial for that.
Okay.
But there's growing concern about their potential impact on the brain and muscles.
So they're helping one part of the body but harming another.
Potentially. Studies have shown that 10 to 20% of patients taking statins experience muscle problems. This can range from like aches and pains to really rare cases of severe muscle damage.
Okay.
And when it comes to the brain, research suggests a possible link between statin use and cognitive decline.
Interesting. What other medications are on the radar?
Well, sleep medications are becoming increasingly popular,
Oh, yeah.
especially among older adults, specifically the non-benzodiazepine types like zolpidem.
I've seen those advertised.
Yeah,
They promise a good night's sleep.
they do, and they can be effective short-term, but there are concerns about long-term effects on sleep quality and brain health.
Oh, really?
Yeah, so they can disrupt deep sleep.
Which is important.
Yes, it's the stage of sleep that's crucial for memory consolidation and brain regeneration.
Wow.
And there's also the risk of dependence, so people might need higher and higher doses to get the same effect.
That's worrisome. We're being told to take these medications to sleep better, but they could actually be harming our brains.
Yeah, it's a complex issue for sure.
Okay, so we've got anxiety, insomnia, cholesterol, sleep. What else?
Antidepressants.
Oh,
So they play a vital role in treating depression and anxiety.
yeah. A lot of people rely on those.
Yeah, and they can be incredibly helpful, but they also come with potential neurological side effects.
Okay, so even these, which are supposed to help, could potentially be harmful.
Right. Certain types, like tricyclic antidepressants, have anticholinergic effects.
So they interfere with acetylcholine, like those other medications we talked about.
Exactly, which can lead to cognitive problems, especially with long-term use.
Okay.
And while SSRIs, which are a newer type, are generally considered safer when it comes to cognitive effects, there's still debate about their long-term impact on brain health.
Okay, so it seems like just about everything we're taking has potential risks.
It can be overwhelming to think about all the potential risks, yeah.
What else should we be cautious about?
Well, antipsychotics, which are used to treat schizophrenia and bipolar disorder,
Okay.
those have been linked to cognitive decline and dementia, especially in older adults. Okay. And opioids, of course, they're essential for managing severe pain.
Right.
Long-term use of those, although sometimes necessary, can lead to dependence and structural changes in the brain, potentially affecting things like memory and emotional regulation.
Wow. Anything else?
One more to mention is proton pump inhibitors, or PPIs. These are used to treat acid reflux and ulcers.
Okay.
And while they're effective for that, there's concern that long-term use might be linked to nutrient deficiencies, particularly B12.
Which is important for brain health.
Exactly.
Yeah.
So by reducing stomach acid, they might prevent your body from absorbing essential nutrients.
So it's almost like trading one problem for another.
Yeah, and studies have suggested that B12 deficiency can contribute to cognitive decline and increase the risk of dementia.
It's a lot to take in.
Right.
It seems like everything we're taking has some sort of side effect.
It's important to remember that medications are powerful tools and can be life-saving,
Yeah.
but we have to use them wisely
Eat informed.
and with awareness of both their benefits and potential risks.
You've definitely given us a lot to think about. It seems like traditional medicine, while it's essential, may not always have all the answers, right?
Yeah.
And may even be overlooking or downplaying some of the potential harm.
That's right.
It makes you wonder if there are alternative approaches out there that could be safer and more effective in the long run.
Yeah, that's what we're going to get into in the next part of our deep dive.
Absolutely. So stay tuned. We're going to be looking at some really interesting alternatives.
Yeah, some exciting possibilities.
And how we can start taking control of our health in a different way.
Yes. Stay tuned. So we've talked about some pretty unsettling stuff, right? About the potential downsides of these common medications. Yeah, it's definitely a lot to think about. But it's important to remember, I think, this isn't about demonizing all medications.
Right.
Or rejecting conventional medicine altogether.
For sure.
It's about being informed.
Right. And having the power to make those choices
Exactly.
for our health.
Yeah, and exploring what options are available.
Yeah. So that's where things, I think, get really interesting.
Yeah.
Because there's this whole world of natural remedies that have been used for centuries.
Right.
And while they kind of get pushed aside by mainstream medicine,
Yeah, they often do.
there's a growing body of evidence suggesting that they may actually hold the key to preventing and even reversing some of these chronic conditions
Absolutely.
that we're facing.
It's fascinating.
So what are some of these? I know our sources mentioned coconut oil.
Yeah, coconut oil is great.
What's so special about it?
It's a rich source of medium-chain triglycerides,
Okay.
or MCTs.
MCTs, okay.
Now, your body processes these differently than other fats. They get converted into ketones,
Okay.
which can act as an alternative fuel source for your brain.
Wait, so our brains can run on something other than glucose?
They can, yeah.
That's kind of crazy.
It is. And this is really important when we're talking about things like Alzheimer's disease,
Okay.
where the brain's ability to utilize glucose is often impaired.
Oh, wow.
Ketones can kind of step in and provide that much-needed energy, potentially slowing down or even reversing cognitive decline.
So coconut oil is like a backup generator for the brain.
That's a great way to put it.
That's amazing.
Hmm.
Is there research to back this up?
There is, yeah. There was a study in the journal Neurobiology of Aging,
Okay.
and they found that ketones might improve cognitive function in people with Alzheimer's disease.
Okay.
There's also a really interesting anecdotal account from Dr. Mary Newport,
Okay.
who's a physician who used coconut oil to help her husband who had Alzheimer's.
Oh, wow.
She actually observed remarkable improvements in his memory and behavior after adding coconut oil to his diet.
Really?
And her book, Alzheimer's Disease, What If There Was a Cure?, goes into detail about this experience. And it's really sparked a lot of interest in this natural remedy.
Wow, that's incredible. Just something as simple as coconut oil can have that kind of impact.
It's pretty amazing.
And so beyond this like brain boosting effect, are there other benefits to coconut oil?
Oh, for sure. It also has anti-inflammatory and antioxidant properties,
Okay.
which are essential for protecting your brain from damage.
Okay.
We're learning more and more that inflammation is a major driver of so many chronic diseases, including neurodegenerative conditions.
Yeah, makes sense.
So by reducing that inflammation, coconut oil can help create a healthier environment for your brain to thrive.
Like a multi-pronged defense system.
It is.
So how much are we supposed to be eating, like to actually get these benefits?
That's a great question.
Yeah.
It varies from person to person depending on their needs and their tolerance.
Okay.
Some people start with just a tablespoon a day and gradually increase the amount.
Okay.
You can put it in your smoothies, your coffee, use it to cook.
Okay.
You can even have a spoonful straight up if you want, although the taste might take some getting used to.
It's not for everybody.
Yeah, not for everybody.
All right, so coconut oil definitely sounds like something to try.
Mm-hmm.
What about other natural remedies? You mentioned golden milk earlier.
Oh, yeah, golden milk is great.
What is that?
So it's this ancient Ayurvedic drink
Okay.
that's become really popular recently, and for good reason. It's traditionally made with turmeric, ginger, black pepper,
Okay.
some other warming spices, usually blended with milk or a plant-based milk alternative.
Yeah, so those all sound like pretty healthy ingredients.
They are.
But what makes it so good for our brains?
Well, the star ingredient here is turmeric,
Right.
which contains curcumin.
Okay.
And curcumin has really potent anti-inflammatory and antioxidant properties.
Okay.
Studies are actually suggesting it might have neuroprotective effects.
Okay, what does that mean?
So it could help protect your brain from damage and potentially even play a role in preventing or delaying cognitive decline.
So it's like adding another layer of protection.
Yeah.
Is there any evidence to support this?
There's a growing body of research looking into curcumin's benefits for brain health.
Okay.
For example, studies have shown that it can reduce inflammation in the brain,
Okay.
which is a key factor in a lot of neurodegenerative diseases.
Okay.
There's also some evidence suggesting that curcumin might improve memory and cognitive function.
Interesting. So it's more than just a trendy drink.
Yeah, it's got a lot of potential therapeutic benefits.
What's the best way to take it, or how do you make it?
You can easily make golden milk at home.
Okay.
There are tons of recipes online, or you can even find pre-made mixes at health food stores.
Okay.
The combination of those spices, the turmeric, ginger, and black pepper, creates a really warming and flavorful drink.
Okay.
It's soothing for your body and mind.
I'm sold. I'm definitely going to try this.
You should. It's amazing to think that these natural remedies, they've been used for centuries in these traditional medicine systems.
Yeah.
And now they're finally being recognized
Yeah.
for their potential
Is there potential?
to support some of our modern day health challenges.
It's like we're rediscovering them.
We are.
And it makes you wonder, why are these so often dismissed by conventional medicine?
That is the question, isn't it?
Yeah.
You know, is it because they don't fit into that profit-driven model of the pharmaceutical industry?
That's a good question. It's like this disconnect between this wisdom
Right.
of ancient healing and our modern medical system.
And this disconnect might be costing us,
Yeah.
in terms of our health and our wallets.
For sure.
Because natural remedies like coconut oil and golden milk, they're not only effective, they're affordable and accessible.
Right.
They kind of empower us to take control of our health without relying solely on expensive medications.
Which often come with those side effects we talked about.
Oh, exactly.
It's a good reminder that we have more options than we might realize.
Mm-hmm.
And that maybe it's time to start questioning the status quo a little bit and look at some of these alternative approaches.
With an open mind.
Yeah, absolutely.
It's about reclaiming our health and embracing the wisdom of nature.
All of that.
It really starts with being informed and making those conscious choices.
About what we put into our bodies.
Yes.
So we've talked about the downsides of some of these common medications and then the possibilities of these natural remedies.
Right.
But how do we actually put this into action? What are some practical steps?
That's a great question. That's what we're going to talk about in the last part of our deep dive.
Okay, great.
So stay tuned.
Yeah.
And we'll give you some actionable tips and strategies to help you navigate all of this.
Sounds good.
Make good choices for a healthier future.
Awesome. Looking forward to it. So we've talked about a lot,
Yeah, we really have.
about the medications, the natural remedies.
Mm.
Where do we go from here?
Right. It's all about action.
Yeah. What do we actually do with this information?
Well, I think the first step is being an informed and empowered patient.
Okay.
Don't be afraid to talk to your doctor.
Yeah.
Have open and honest conversations about any medications you're taking,
Yeah. Ask questions.
especially about the ones we talked about today.
Mm.
You know, what are the potential long-term risks?
Right.
Are there alternatives?
It's about being proactive,
Exactly.
advocating for yourself,
Yeah, taking charge.
and remembering that it's not just about medication, it's also about lifestyle.
Oh, absolutely huge.
Like what we eat, how we move, how we sleep.
It all has a huge impact on brain health.
So diet's a big one.
Diet's crucial.
What should we be eating?
Think vibrant, colorful foods.
Okay.
Fruits, vegetables,
Okay.
lean proteins, healthy fats.
So ditch the processed junk.
Yeah, as much as you can.
And movement's important too.
Movement is so important. Exercise gets that blood flowing to your brain.
Okay.
It stimulates new brain cell growth,
Wow.
helps protect against that cognitive decline.
It's good for the heart, good for the brain.
Exactly.
Can't forget about sleep.
So important.
7 to 8 hours.
At least.
That's when our brain kind of recharges.
That's when it repairs and rejuvenates.
We have to talk about those natural remedies again.
Yeah.
Should we all be adding coconut oil and golden milk to our routines?
I'm a big fan.
Yeah.
But it's really about finding what works best for you. Start slowly, see how your body responds.
Okay.
Talk to your doctor, especially if you have any health conditions.
So it's not one size fits all.
Right. It's personalized.
It's about taking responsibility.
It's for your own well-being.
This has been so eye-opening.
It's a lot to take in.
I'm really feeling inspired to kind of look at my habits
Yeah,
and maybe try some of these natural remedies.
that's great.
I think that's what it's all about, right?
Empowering yourself with knowledge
Yeah.
and then taking action.
It's a journey.
It's a lifelong adventure.
I'm ready for it. Well, we'd love to hear from you guys. What did you think? What resonated with you? What changes are you thinking about making? Share your thoughts. Share your experiences in the comments. And don't forget to subscribe to The Deep Dive
Yes.
for more deep dives.
Our fascinating explorations.
into health and wellness.
The power of NAR.
Cut those brains sharp.
And keep diving deep.